So this next part, you're going to be listening for some more sentences. The difference this time is that it's like you're at a party, so you will hear background noise. The Audiology Clinic is a place where veterans can come that have hearing difficulties, tinnitus difficulties. We even treat some different balance and other hearing-related, ear-related disorders. We do hearing fittings, hearing aid checks, hearing tests. We do different vestibular testing. We have a cochlear implant program, and we also have different services at CBOX as well. Hearing loss, there's different types of hearing loss, and so a hearing test will help the doctor determine whether it has to do with the hearing nerve, or maybe there's something medically wrong, or maybe there's both. Sometimes we see what we call mixed hearing losses. But the hearing test tells us what that is and where that site of lesion is. And depending on what type of hearing loss we're seeing, that's going to determine the treatment. Sometimes it's hearing aids, sometimes it's a referral to ENT, sometimes it requires further testing to make sure that there's something else not going on that hearing nerve. So it's really important to determine the site of lesion or what type of hearing loss a veteran has. The most common type of hearing loss does have to do with the hearing nerve, and that's the most common type that we see. It's also the one that's not medically correctable. So it's something permanent, something that we expect to get worse as we get older or as we're around loud sounds. So we strongly encourage anyone at any point to wear ear protection if they're around anything loud. But with a sensory neural hearing loss, we do usually recommend hearing aids if they're appropriate. And while the hearing aids won't cure the hearing loss, they'll help the veteran hear better and interact in their situations better. And a lot of times that's very helpful. Tinnitus or tinnitus, both are correct. That is something that a person hears, but it does not have an external source. So no one else can hear it except for the person. Currently, many thousands and millions of people have tinnitus, but they're usually not bothered by it, meaning they can go through their daily activities and not be affected. There is a small portion of patients that have it, and it is bothersome. It does limit their daily activities or negatively impact them in some way. And for those, that small group of patients, they sometimes need a little assistance to help get them on the right path of managing their tinnitus. Unfortunately, there's no current cure. So the goal of treatment for tinnitus isn't necessarily to cure it or take it away. It's to support their life and to address those problem areas and help those areas. You know, it's important if hearing or something is impacting the quality of life, especially interacting with family or with their medical doctors so that they can make important medical decisions. It's very important for the veteran to be able to engage and communicate in those situations. And so if they are having challenges with their hearing, that's something that the VA can help with and that we want to help with.